Hello everyone, my name is Shivanti Jones and this is the Unit 3 assignment for HCM 603. This is the agenda for today's presentation. First off, we will look at the difference between a healthcare consumer and a healthcare patient. Then we will look at the different types of healthcare consumers. We will answer the question, what type of healthcare purchases do people make throughout their lifetime? Then we will do some data analysis for pediatricians for Cass County, North Dakota, and we will end the presentation with some questions. There are two types of individuals in the healthcare industry: healthcare patients and healthcare consumers. These two terms are sometimes used interchangeably, but they are not the same. A patient is a healthcare consumer, but not all consumers are healthcare patients. Patients, in general, receive care from a hospital, and consumers make choices about their health. And that is the main difference between healthcare patients and healthcare consumers. There are 6 types of healthcare consumers. The casual and cautious are not engaged in their own health, have no immediate need to consume healthcare services, and are not cost conscious. The content and compliant comprise of about 22% of the US healthcare population, and they are happy with their physicians, hospitals, and insurance plans. They tend to comply with and follow care plans. Online and on board, and this accounts for about 17% of healthcare population, are keen to learn about health online. They are happy with the healthcare but are looking for alternatives and for new technologies. The sick and savvy. Because of their conditions, they consume significant healthcare products and services. They also communicate and partner with their physicians to make treatment decisions. They comprise about 14% of the US healthcare population. The out and about. These independent 9% of the US healthcare consumers believe in looking for alternative healthcare options and prefer to customize the services they wish to consume. Shop and serve are 4% of the US healthcare consumer group and actively look to save money. They're also willing to switch product and services for better value. Part of this assignment was to ask friends and family, our co-workers, about any products and services they purchased within the last year that they were really excited about. This came up with quite a number of products, from washers and dryers to a house. But when you got to the nitty-gritty details of how many of those products were healthcare related, the excitement level just plummeted downwards. Healthcare purchases are not usually very exciting purchases, and most of the time they are purchased out of necessity. Out of my questions that I asked a few of the people I know, the most common ones were breast pumps and supplies, knee braces and support, contact lenses and solution. One of them had a hospital stay for a broken leg and had to get crutches after that. Most of them, dental and vision plan, which was not part of the health coverage they received, or FSAs, diabetic monitors, test kits, strips, and supplies, and one of them had an appendicitis surgery and had overnight stay. So these are some of the most common healthcare related purchases, but none of the people I interviewed were really excited about these purchases, and they were purchased out of necessity. The data analysis I did was for Cass County, North Dakota. The largest city in Cass County is the Fargo, West Fargo, North Dakota, and Fargo and West Fargo account for about 95% of the Cass County population. The population trend in Fargo and West Fargo is um, was projected to be around 124,844 in 2018. 23,739 of them were under the age of 18. I did a search on Dr. Finder and the American Medical Association website to find some physician information for Cass County, North Dakota. Specifically, I looked for pediatrics. Cass County has 64 pediatricians, with only 5 of them registered with AMA. All of them are located in and around the Fargo-West Fargo metro area. This is because Fargo has 2 major hospitals, Sanford Health and Essentia Health, and almost all of these pediatricians tend to be employed in either of those healthcare facilities. According to WebMD, pediatricians are doctors who manage the health of your child, including physical, behavior, and mental health issues. They're trained to diagnose and treat childhood illnesses from minor health problems to serious diseases. Cass County pediatrician demand projection for 2019 per 100,000 population was 51.26. The United States pediatrician demand projection for 2020 per 100,000 of the population was 18.8. Cass County has more than average number of pediatricians compared to the national rate. It's almost 2.5 times more than the national average. The reasons that I could think of were the lower population in North Dakota, the affordable cost of living, which attracts a lot of doctors, physicians, including pediatricians from around the United States, and the growing healthcare sector are some of the reasons that the rate in in Cass County is higher than that of the national average. That brings me to the end of my presentations. If you have any questions, feel free to reach out to me. If not, thank you for listening and have a good day.